Well, I'm Hani Salehi-Had. I'm pleased to speak with you regarding our first eye drop treatment that's poised to be developed for diabetic macular edema. OCS-01 is a cyclodextrin formulation of a dexamethasone. So cyclodextrin is an oligosaccharide that forms a multimer. It forms a micro and nanoparticle spontaneously with the medications that we're using, in this case dexamethasone, and it allows us to deliver something that's hydrophobic in a hydrophilic environment. So that's OCS-01 in a nutshell. And we are using this formulation to deliver the medication dexamethasone to the eye for diabetic macular edema. So we are always after finding better and less invasive treatments for all the diseases and the conditions that we treat. Currently, our standard of care treatments are injection of intravitreal medications on a monthly basis or every other month. And for diabetic macular edema in particular, to have an alternative route of delivery of a medication that could potentially treat this condition is revolutionary. We're hoping that this drop and this formulation is going to be able to do that at least, or have a space besides the anti-VEGF medications that we currently use. So the Diamond study, which we are presenting today, is a phase 2-3 study. It's come in two stages. This is the first stage of this trial, and in this stage we're really after dosing regimen and proving that the dosing regimen that we want to use in the second stage is going to be efficacious. So in this stage of the trial, we used the OCS-01 eye drops in two stages. We did a loading dose of 6 weeks and a maintenance phase of another 6 weeks. In the initial phase, we used OCS-01 6 times a day. And in the maintenance stage, we used the medication 3 times a day. And our hope is that this same dosing regimen is going to be effective in the second stage. In this stage, we were able to show that there was a significant reduction in central macular thickness in the OCS-01, and there was a significant visual gain also in the OCS-01 treated group versus the sham. And all these findings were statistically significant. They started early, the improvement was early. After the second week, we saw a significant reduction in central macular thickness, and that was maintained throughout the whole time frame. So there were definitely no unexpected adverse events. There is always an expected increase in intraocular pressure with any steroid delivery mechanism. However, this was very, very modest in our patient population. We had about 22% of patients that had any increase in intraocular pressure. Any increase in intraocular pressure. Only about 14% of patients had an increase of more than 10 IOP over their baseline. And only one patient out of 100 had an IOP of 35. So the numbers are pretty low, but they're in line with expectation with dexamethasone. So in the second stage, we hope to carry on the same results and go in a longer duration of treatment and see if the efficacy improves over the long duration of treatment. Again, if we're looking at diabetic macular edema with any treatment, for example, anti-VEGFs, there's a significant improvement with the first 3 injections. And that's the first 3 months. But that increase continues slowly over time, even beyond that. So is OCS-01 going to do the same, or will it maintain the same improvement in visual acuity that we saw? That's the hope, but obviously we're doing the trial to find out. Well, I mean, I think a lot of it has to do with manufacturing guidelines and following those guidelines and the stringent methods that different companies follow these. You know, I think this particular question comes up because of the artificial tear drops that cause infections. And you know, we've used medication eye drops for many, 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 many years. With the formulations that are done in the proper facilities, you know, we don't really see much of this. And if you consider how long we've used eye drops and how few of the cases we've had of these outbreaks, I think it goes to show you that they're still a very, very, very safe route of delivery. Especially in this particular condition, if you're going to compare it to other treatment options, you're treating patients with eye drops versus giving them intraocular injections, where we know there's always going to be a risk of endophthalmitis, which is severe. And with eye drops, if that risk is there of any kind of ocular surface infection, compared to the risk of endophthalmitis, I think that pales in comparison.
I appreciate it.